Good evening, everyone. Good afternoon. We just opened the room for the participants, so we're going to give a few minutes and then we'll start. We have all the speakers waiting. Thank you.
Hello?
Yes, we were just waiting a few more to join and then we'll start. Good morning, good afternoon, maybe good night for some. My name is Maristela Monteiro. I'm the Senior Advisor on Alcohol and Substance Abuse in Washington, the Pan American Health Organization. And it's my pleasure to be here to moderate and organize this webinar today. As time passed with the COVID-19 pandemic, we've learned more about what happened in general and in particular with alcohol as well. And there is still a lot to learn. So this is an opportunity to take stock of what has been done, published, and what else needs to happen for the future and what we can already plan in moving forward as we return to a new normal. So I would like to start and give the opening remarks to Dr. Renato Oliveira, the Unit Chief on Mental Health and Substance Use Unit at the Department of Mental Health, Department of Non-Communicable Diseases and Mental Health, that he is going to speak on behalf of Dr. Hennis, who could not attend and give these opening remarks today. Floor is yours.
Thanks, Maristela. Thank you very much. Let me just organize a few things here. Okay, so welcome and thank you. Thank you for joining us today. It's been over 18 months since the COVID-19 pandemic has taken the highest priority on the political, economic, social, and public health agenda worldwide, including here in the Americas. The pandemic has resulted in the loss of millions of lives, and we know that people living with non-communicable diseases have both a higher risk of contracting COVID-19 and also poorer outcomes. In our region, the harmful use of alcohol is a significant risk factor linked to non-communicable diseases, injuries, and many other conditions, causing over 380,000 deaths a year. Cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases are responsible for approximately 80% of all deaths in the region. And with COVID, an increased relative mortality has been documented. Among the many social changes brought up by the pandemic, alcohol consumption, particularly where and how people consume alcohol, was a significant one. Many countries closed bars and restaurants as a result of government measures to minimize transmission. And yet, alcohol sales often increased as people stockpiled to drink at home, either in isolation or among family members. Alcohol consumption became part of family life, mixed with work life, and used to cope to the many stressors affecting everyone to some extent, including fears, anxiety, depression, bereavement, job insecurity, changes in childcare and schooling, and boredom. Consequently, women, parents of young children, middle-aged people, higher-income individuals, and people with depressive and anxiety symptoms reported the highest increase in alcohol consumption. Domestic violence, known to be worsened by alcohol use, increased. During the COVID-19 pandemic, heavy episodic drinking among drinkers increased also in our region. And at the same time, in-person treatment services for those with alcohol dependence were restricted, while counseling and self-help assistance went online. While online services were appealing to some, many didn't have access to reliable technology or the privacy to use them. Alcohol delivery services and online retail sales skyrocketed as well, offering new and easier ways to access alcohol and drink in the privacy of one's home. Online alcohol marketing, especially on social media, also increased substantially, possibly exposing young people to alcohol consumption. Some of the biggest players in the alcohol industry have used the pandemic to promote a favorable image and their commercial agendas under the guise of corporate social responsibility activities, such as forming partnerships with governments and civil society organizations to assist in the pandemic response while promoting their brands. It's clear that if we do not prepare now for the recovery from the pandemic, the toll of alcohol-related harm will only increase in a region that already has a high burden from alcohol consumption and very limited policies in place to reduce its impact. The health, social, and economic harms from the harmful use of alcohol will have long-lasting implications if no action is taken on the drivers of such harm, including price, availability, and marketing. A surge in treatment needs will require new services and new innovative and inclusive ways to increase treatment coverage for those in need, often those who are among the most vulnerable groups of society as well. Therefore, the time for action is now. We must ensure that alcohol control policies are not rolled back or replaced by policies that promote and increase alcohol use, but rather is strengthened to prevent the premature deaths and disability of thousands, if not millions in our region. PAHO is actively working with countries in the region to provide guidance and help implementing effective measures, such as the Safer Initiative to promote policies to reduce the harmful use of alcohol in the region. An awareness campaign is planned to be launched in the next month or so. This is a timely and this today we are here and this is a timely webinar, given that tomorrow, the 31st of August, will be the first global consultation on the WHO Alcohol Action Plan with emissions from all member states. It's crucial that public health is placed at the center of that plan and that member states support actions that are proven to work and choose to work only with those stakeholders who are free from vested interests and do not become roadblocks to a world free from alcohol-related harms. Thanks again for joining us, and I wish you an excellent webinar.
Thank you very much, Dr. Oliveira. And I'll be moderating now the session, even though I'm the first presenter. And I will introduce the speakers now, so you have an idea of the quality and extensive experience of all of them. The first speaker after me will be Dr. Jurgen Ram. He is a senior scientist in the Institute for Mental Health Policy Research and in the Campbell Family Mental Health Research Institute at the Center for Addiction and Mental Health. He is a professor and was the inaugural chair of addiction policy in the Dalla Lana School of Public Health at the University of Toronto, and he also holds professorships and positions in Germany, Spain, and Russia. Dr. Ram has been a leader in generating, analyzing scientific data needed to inform clinicians and policymakers on strategies to reduce alcohol, tobacco, and other drug attributable harm. His recent research has increasingly included interactions between socioeconomic status, poverty, and substance use, including analysis of policies and interventions with respect to reducing or increasing inequalities. His work has been awarded with numerous awards and prizes, most importantly, the Jelinek Memorial Award, the European Addiction Research Award, and the Caricom Society Award for Advancement of International Research Collaboration. Then we'll have Dr. Jeff Collin. He is a professor of global health policy at the University of Edinburgh. A political scientist by background, his research centers on the regulation of unhealthy commodity industries and their engagement in health governance. Current research interests focus on managing conflicts of interest in health governance and on promoting policy coherence in NCD policies. He is a co-investigator in the Spectrum, which is an acronym for Shaping Public Health Policies to Reduce Inequalities and Harm, a UK prevention research partnership consortium examining the commercial determinants of health and leads its work stream on governance for health equity. He engages extensively with international health agencies and civil society organizations across alcohol, nutrition, and tobacco control policies, including as a board member of the Alcohol Focus Scotland and an advisor to the Institute of Alcohol Studies. We will then have Alafia Samuels. Dr. Alafia Samuels is a former director of the Georgia Lane Chronic Disease Research Center at the University of West Indies, Barbados, is now with the Caribbean Institute for Health Research in Jamaica. She's a medical doctor trained at the University of West Indies, Mona. She also holds an MPH and PhD in chronic disease epidemiology from Johns Hopkins University. Her career has included both working with the Ministry of Health Jamaica, delivering and managing public sector health programs for 20 years, and academia at the University of West Indies for the last 10 years. She's a member of the PAHO Technical Advisory Group for NCDs in the Caribbean, technical advisor for the Healthy Caribbean Coalition, chair-elect of NCD Child, co-chair of the World Obesity Federation Policy and Prevention Committee, and a Lancet One Health Commission. Her research interests include policy, practice, and evaluation of NCD prevention and control programs and translating evidence into practice. She has more than 50 publications in peer-reviewed journals and led the formal evaluation evaluation of the Caricom heads of government, the 2007 Port of Spain Declaration of NCDs, and reports annually on the NCD to the Caucus of Ministries of Health of 20 Caricom countries. And finally, she was an author in a 2016 Lancet profile that dubbed her as the fast food watchdog of the Caribbean. And then we'll have Michel Sekine. He is responsible for the program on public health at OECD, the Organization for Economic Cooperation and Development. Michele's research interests include priority setting and evaluation of policies influencing population health. He is the editor, author, and co-author of a large number of publications on the economic aspects of public health, including the recent OECD flagship publication on preventing harmful alcohol use, overweight, antimicrobial microbial resistance. Michele represents OECD in the board of the Global AMR Research and Development Hub and holds a position of adjunct professor in applied health economics at the School of Public Health at the University of Siena in Italy. Previously, he held a visiting position at Duke in US Graduate Medical School in Singapore and served as a temporary advisor to a number of government and intergovernmental agencies, including WHO, IARC, the European Commission, the World Bank. After obtaining a degree in medicine and surgery from the University of Genoa, Michele completed his specialist training in public health at the University of Siena. He also obtained a master's degree in health policy, planning and financing from the London School of Economics and the London School of Hygiene and Tropical Medicine, and a PhD from Imperial College, London. So as you can see, we have very top senior experts that will help us with this discussion today. So I'm going to start with a snapshot of the situation in Latin America and what PAHO has done during last year. Let me share my screen. Can everybody sees it? Oh, no, probably not. I need to share the screen. Okay. Sorry.
Yes, we see your screen.
Okay, thank you. So what was the situation on alcohol consumption harms in the Americas pre-COVID? We know the Americas has the second highest average per capita consumption, just after the European region, and is well above the global average. The Americas has the lowest level of abstention in the world, and in 2016, 46.1% of the adult population drank in the past year. 25% of the general population are heavy episodic drinkers. And we also have the highest prevalence of alcohol use disorders for women and the second for men in the world, according to WHO. In 2016, there were an estimated 379 alcohol attributable deaths in the Americas, representing 5.5% of all deaths and over almost 19 million disability life-adjusted years. Alcohol use is a risk factor to many conditions, and especially 7 of the 8 leading causes of death among 15 to 49 years old in the Americas are linked to alcohol. And in terms of policies, we know there is a lot to be done, and we are not on a good score. Only 8 countries in the Americas have a national written policy, while others either have a subnational policies or do not have any policy at national level. And we have done an analysis using a score system, the same that was used in the European region before, to score the 10 areas of the global alcohol strategy in every country of the region. And here is just to give you a snapshot of the average that we obtained in the policy score in these 10 areas. And in circles are the ones considered to be the most cost-effective policies that we have on pricing, marketing, and physical availability of alcohol, and these were the lowest on average compared to all the others. With alcohol, when the pandemic hit the region, one of the first features that we've seen was the spread of misinformation. That was very fast, people using the internet and social media and all sorts of information or fake news spread rapidly from that alcohol could destroy the virus, that drinking strong alcohol could kill the virus if even if it was inhaled in the air, the alcohol would stimulate immune system, and that people with alcohol dependence would not get infected. And at the same time, also perpetuating a message of sympathy that in the when there are so many events and so many problems, stresses affecting everyone, drinking would be okay. So PAHO responded initially with fact sheets that were produced in conjunction with the European office and spreading it through social media, with participating editorials in scientific journals. And we organized many webinars during the year, either in English, Spanish, Portuguese, organized Facebook live sessions. And also we decided to do a regional online survey on alcohol consumption and COVID that at the end resulted in 2 scientific publications, plus a PAHO report. So here is, I'll briefly present what the results were. We got participants from 33 countries in the region of the Americas. The US and Canada were not included, it was only Latin America and the Caribbean. And we got over 12,000 valid responses. And the questionnaire was anonymous and covered demographics, questions about quarantine measures, and also consumption before the pandemic in 2019 and during the pandemic. But it needs to be said that the survey was done relatively early in May and June. It started 25th of May and at the end of June. So much more could have happened and did happen after that as well. So it shouldn't be just generalized, in addition to the fact that the survey is not representative of the population in the region, but only of those who answered the survey. So here are some of the key results. Overall, there was a decrease in consumption from 19 to 20 in both men and women. And there was a trend not shown towards the consumption of strong types of alcohol products, decreasing overall prevalence, but those who did use increased the frequency of illicit and informal alcohol use, alcohol beverages. And the overall majority did not seek help for reducing their drinking before or at the time of the survey. You can see here in this graph that's very clear. People do not seek help to reduce their alcohol consumption. And this was asked only to those who reported have episodic drinking and not to the whole population, to all respondents. The prevalence of heavy episodic drinking also is reported to have decreased, but what is most interesting is that the frequency of heavy episodic drinking changed. And those who did in 2019, the majority of them did not change their pattern of use. So that means they continue to have heavy episodic drinking. And about a third decreased, and we got about 13% that, or between 10 and 13, that actually increased the frequency as well. And analysis of heavy episodic drinking during the pandemic indicated that it was more prevalent among those with higher income who could afford more alcohol, was more prevalent among younger cohorts, 18 to 39, and among males, was associated with negative mental health feelings, emotions, particularly stress, and with the adoption of the quarantine measures. So the impact of COVID on alcohol is still not fully understood. We need to assess and evaluate various scenarios, and we can have factors that increase consumption and also decrease alcohol consumption. While some harms may have reduced, like road injuries because of the quarantine measures and lockdowns, public venues or bars and restaurants closed, is expected that the public violence would reduce, but there are reports in general, in several places, of increases in domestic violence, child abuse, but the link with alcohol is difficult to assess. And it would not be ethical. It may put in danger, actually, women responding to a survey at home about that. And an increasing exposure of young people to drinking, online marketing and promotions, and the less access, as it was mentioned before, to treatment services. And we don't know about alcohol-related diseases and the potential in the future also that they will be developed, such as alcohol dependence, if people increase their consumption over time and may not be able to reduce again. So there are many opportunities and new frontiers for alcohol policy and for research. We need to regulate the e-commerce and online marketing. We need to strengthen and keep the current policies, accelerate training of health professionals, increase telehealth for alcohol use disorders and alcohol brief interventions, increase the coverage of treatment, which was already very low and unacceptable. And on the other hand, increase the health literacy, the reliable information that the general public needs to have, and not be influenced so much by all the fake news or misinformation in the web. We need to balance economic and public health interests and promote an alcohol policy preparedness and response for future emergencies. This is the time to learn from what we had and avoid that in the future. With that, thank you very much. Okay, we're going to leave all the questions to the end. Now, without the delay, the floor is with you, Jurgen.
Okay, thanks a lot, Maristella. I'm just making it big. So my job is to look into alcohol and COVID-19 in North America. You've already heard from Maristella how alcohol and COVID and alcohol consumption was impacted by COVID in PAHO countries, except for North America. I will now speak a little bit more of detail in the 3 North American countries, Mexico, the US, and Canada. So basically, when we speak about alcohol and COVID, and that was the task which was given to me, there are 2 causal directions possible. First, we have COVID, confinement, social interactions, has impact on alcohol use and impact on alcohol harm. Second, we have alcohol use and alcohol use disorders, which can impact and which did impact on COVID-19 and the attributable consequences. So my presentation will go into both directions. First direction is from COVID to harm. And basically, we did 3 reviews on all of the global publications. And globally, and in most countries, alcohol and illicit drugs decreased during COVID-19. However, the availability of, however, this is not true for all countries. Where it was decreased, there are effects on the availability of alcohol, which was reduced due to measures of confinement. There's also different scenarios for affordability. Affordability could go into two directions, and we'll come into examples there. There are those market differences, and the biggest difference, which we found in the first analysis, was whether alcohol was deemed an essential good or not. And they have a lot of evidence currently, more than 30 publications, that those who already consumed alcohol heavily in part increased their consumption. And that may not only be with an increase in frequency of heavy drinking, but also with drinking higher amounts within the classification of heavy drinking on average. So what are those mechanisms which are underlying? First, there's this distress mechanism. Alcohol use has been shown to be a maladaptive coping strategy to manage psychological distress due to the pandemic. And that is quite a finding which we found in more than 30 countries. The second is the availability, affordability mechanism. In general, there's a reduced number of drinking occasions due to closure of outlets and consumption sites, and reduced affordability. And that's due to growing unemployment, due to higher financial insecurity. However, in some countries, in some regions, alcohol was made more affordable to cope with this for alcohol industry. So basically, while we have general effects, we also have the exceptions from the rule. Now, what kind of cohort studies do we have in North America? There are basically only two cohort studies, and these are all the outcomes. What you see here is a mixed bag overall, and you basically see that most of the p-values in those are non-significant. So in North America, in cohort studies, we have non-significant events as the most prevalent outcome for true cohort studies. Then there are cross-sectional studies. These would be studies where people were asked during the pandemic if they increased or decreased their drinking. That's similar to what Maristella has shown. And it's self-report, and it's not two measurements, it's just one measurement, and the impression of what people believe they did. Whereas in the cohort studies, we have two independent measurements. Most study, mainly from the US, have shown that, again, there are mixed results, some showing increases, some decreases, and several non-significant. Mexico, instead of the US, seems to have reduced consumption. In the national survey, this is pretty clear, in part because alcohol by the government was declared a non-essential good, and there were some state dry and partial dry laws. And these findings of reduced consumption were also corroborated by a reduction in hospitalizations. Both of those measures alone would not be sufficient because a lot of the people just didn't go to the hospitals because of fear of COVID. So what can we learn methodologically for this research? Well, first of all, we have quite a lot of limitations because a lot of what we know is based on survey. And they're often convenience samples, and there are no longer real representative surveys. Why aren't they representative? Very simple. If you look into what's called representative surveys these days, the sampling frames are very inadequate. We have a lot of groups which are not part of the sampling frames. We have non-response rates of 50, 60%, and we have non-coverage rates that all of the alcohol which is consumed in a country, only 40 or 50% of the alcohol is covered. Thus, we can only speak about final results when we do the proper triangulation with the government-validated APC figures. And for North America, these figures are as such. In the US, we have currently the final data from 12 states. They would indicate an increase of 5% of alcohol per capita consumption. In Canada, we have the final data. There was also an increase. In Mexico, there seems to be a decrease. That means North America was one of the regions which was actually increasing consumption when the world overall decreased. And part of that is due to a lot of policies where governments, local and federal governments, tried to counteract the perceived losses of alcohol industry, who complained bitterly, even in months where they actually had increased their sales. They did as if their sales did not increase and that they're disadvantaged industry and they needed to be helped. And so a lot of the laws changed, for example, by allowing internet sales, for example, by breaking the monopoly in several states, etc. So that was the first one. The second one is the causal direction from alcohol use to COVID-19. Well, does alcohol contribute to COVID-19? This is based on a recent review, and very clearly, yes, by heavy drinking and alcohol use disorders weakening the immune system, and by alcohol attributable disease contributing as risk factors for COVID-19. The evidence on light drinking is mixed, but for heavy drinking occasions, or chronic heavy drinking alcohol use disorders, it's clear that it has very clear connections to COVID-19. And a big study on 33 million US patients, so that's quite a lot. 33 million is a very large sample of patients in the US. They found that alcohol use disorders, that's the second line, has about an 8-fold risk for COVID-19. So basically, it's very clear that heavy alcohol use and alcohol use disorders are one of the bigger risk factors for COVID-19. What are the conclusions of what I have to say? First, regarding the effects on alcohol use, COVID is impacting on alcohol use, and both mechanisms seem to come into play globally. And whereas globally, we expect to overall see some decreases in alcohol consumption, the high-income countries in North America seem to even slightly increase their alcohol consumption based on ill-advised policies of alcohol as an essential good, where sales of alcohol were made much easier via the internet, in supermarkets, etc. The results above are mainly short-term. If trends follow the trends which were seen in natural disasters, and we've made a review on all of the research in natural disasters. All natural disasters seem to have longer term, midterm, and long-term consequences, that there will be an increase in substance use disorders following disasters in the years 2 to 3 after the disaster. Finally, the effects of alcohol on COVID-19. There's the impact of light to moderate drinking is not clear. We have mixed results here, but occasional and chronic heavy drinking markedly increase the risk of COVID via weakening the immune system and via comorbidities. Thanks a lot for your attention.
Thank you very much. Excellent presentation, Jurgen, as always. And I'll pass the floor now to Jeff Collin.
Thanks very much, Maristella, and thanks for the invitation to speak this afternoon. I think Isabel's pulling my slides up. Great. Okay, super. Thanks very much. So during the course of the next 15 minutes, I basically want to give a quick kind of overview of the, without being too crude about the strategic value of the pandemic to the alcohol industry with respect to a few key strategic objectives for them moving forward. Next slide, please, Isabel. So I want to look at how alcohol producers have engaged with the pandemic across marketing activities, and particularly their use of corporate social responsibility and philanthropy. I'm going to try and put this in the context of a broader response by unhealthy commodity industries, and the data that I'm presenting is drawing on a crowdsourcing collaboration between our Spectrum Research Consortium and the NCD Alliance, which highlighted the adaptation of marketing and promotions to leverage the pandemic, the role of two specific elements of CSR, cause-related marketing and corporate philanthropy, in advancing strategic priorities. I also want to touch on the significance afforded to partnerships and collaborations with governments, international organizations, and civil society, and to trying to shape debates about building back better, and to conclude by thinking about what this might mean for alcohol governance moving forward. Next slide, please. So the data I'm drawing from is from a crowdsourcing initiative that we undertook in collaboration with the NCD Alliance, where thanks to a really exciting response rate from colleagues, a number of whom I suspect are on the call today, over 1,000 examples were crowdsourced of unhealthy commodity responses across 100 countries. Alcohol was the single biggest industry where we attracted most responses. And we produced a quick rapid report last September in which we kind of grouped and briefly analyzed these around 4 main strategies. So around adapting marketing and promotions, corporate social responsibility and philanthropy, efforts to shape policy environments, and pursuit of partnerships and collaboration. Next slide, please. And this project is still evolving, but you can go in and access a number of examples. There was a very good response rate from across the Americas, and we've actually got a second wave of data being collected where, again, Americas and alcohol is particularly strong contribution. Next slide, please. Okay, so the obvious place to start is the way in which companies very rapidly adapted their marketing activities. And there's a number of aspects here that look kind of quite gimmicky and quite small scale. So we can take examples, for example, some of them pretty tasteless, like Carsten, the craft brewer in Brazil, who said it rapidly produced a good beer is like air, you can't live without it, using their logo to resemble a pair of lungs fairly early on in the pandemic, which seemed of rather questionable taste. There were lots of kind of gimmicking promotions like this from Dos Equis, the beer brand in the US, of a 6-foot social distancing cooler, and some fairly opportunistic promotions like this responsible drinking campaign of We Play This Match at Home in a lockdown context in Colombia in association with Colombian football team. So the gimmicky stuff, okay, it gets a lot of attention. Next slide, please. But I think there's a real risk that we neglect or underestimate the significance of the changes that have occurred for the industry during this context, and the way in which marketing and promotions and distribution and sales are going to be changed fairly fundamentally. So if we look at a campaign, the launch, for example, by Ambev of the Brahma Duplo Malte brand in Brazil, in the absence of usual promotional strategies, they focused on a live streaming concert series and achieved in 2 months what was supposed to be done in 2 years in the context of lockdown in 2020. And just to give some sense of the scale of this, this campaign generated 375 million views, breaking all viewing records, generating 24 times more earned media impressions than the FIFA World Cup had 2 years earlier. So this is really big scale stuff. Next slide, please. And for the alcohol industry, like with the ultra-processed food industry, the pandemic has served to accelerate pre-existing trends towards digitalization. In the case of the alcohol companies, there's a strong emphasis on presenting this digitalization as somehow supporting community. So if we look at Ambev's campaign, Tiendra Cerca, they generated a digital platform supporting nearly 500,000 retailers across Colombia, Ecuador, Peru, Mexico, El Salvador, Dominican Republic, Panama, Paraguay, and Honduras. And while this is undoubtedly driven hugely by the need to increase availability and access during lockdowns, this was presented as somehow being an initiative to support community. So if you look on the CSR pages of the company website, there's all this, aren't we supporting small retailers? If you look at the investor presentation parts of the website, the commercial significance of this platform becomes clear. And we can see other examples of this, like the recent pit stop promotion of creating a new way to buy drinks in Brazil. Making it easier to access alcohol in a number of different contexts. Next slide, please. And if we think about this in strategic terms, we've been doing some work looking at a framework to understand the integration of corporating and corporate social activities using a framework from the marketing studies literature developed by Kotler et al. In 2012. And I just want to briefly give examples from 2 key strands here. So firstly, cause-related marketing, whereby contributions to a cause are linked to product sales or other consumer actions. And secondly, to corporate philanthropy, making a direct contribution to a charity or cause, typically in the form of cash grants, donations, or in-kind contributions. Next slide, please. So cause-related marketing we've selected because the conflicts here look pretty kind of acute. So it describes promotions which are familiar, for example, from breast cancer campaigns, whereby a corporation links a monetary or in-kind donations to product sales or other consumer actions. And there's a fairly direct conflict of interest here in directly stimulating purchase of an unhealthy commodity in order to fund health or a social cause. And secondly, we're looking at corporate philanthropy because this is often seen as somehow neutral or comparatively uncontentious. But it's increasingly clear that alcohol companies, as with other sectors, are using their philanthropic initiatives to advance broader corporate strategic goals, and indeed they're supposed to. Next slide, please. Perhaps the most extraordinary example here is the recent emphasis from Budweiser in the United States, trying to link beer consumptions to vaccination. So a beer on Bud, your first round's on us if you've been vaccinated. So when the nation reaches the White House's goal of 70% of adults being partially vaccinated, AB InBev will kindly buy America's next round of beer, seltzer, non-alcoholic beverage or other AB product to enjoy with family and friends. Next slide, please. Which raises a number of questions about whether this is genuinely a health promotion campaign or rather leveraging health promotion in order to promote an unhealthy commodity. There are other ways in which we can view this. So, for example, if you look at the very large amount of attention that Budweiser was able to generate through foregoing its Super Bowl ad in order for its bigger picture promotion of vaccines. In Mexico, we have similar attempts by Heineken to link their product to vaccination drives by offering to produce 50 tons of carbonated ice for COVID-19 vaccine protection. Next slide, please. And this sort of transitions into corporate philanthropy quite neatly. So Budweiser have sought to present these campaigns as philanthropic donations, as redeploying cash earmarked for sports and entertainment towards containing the outbreak and allocating media airtime towards relaying public service announcements. So $5 million going to the American Red Cross in the United States, $500,000 in Canada. Very strong emphasis on this one team in which Budweiser links themselves with Red Cross societies. Next slide, please. And this is strikingly similar to a strategy used by Coca-Cola that we've been doing some work on. So Coca-Cola similarly announced that they were going to be foregoing their usual marketing activities in order to focus on doing good. So they had a headline promotion of going dark, doing good. What they neglected to inform us was that 3 months earlier, they'd made the decision to reallocate their marketing spend because conventional marketing wasn't working in the context of lockdown. And so this was unambiguously driven by commercial imperatives. Next slide, please. In the alcohol context in particular, there's been a very strong emphasis on using the COVID pandemic as a lens through which to articulate longer standing strategic goals, in particular for alcohol companies to try and present themselves as legitimate partners or collaborators for governments, for international organizations, for civil society groups. If you look at the AB InBev pages around their global COVID response, for example, this is badged around the heading of more ways in which we are part of the solution. And if you look at the pages of Peru, for Ecuador, for Mexico, for Colombia, there's a whole series of pages documenting ways in which AB InBev present themselves as working in partnership with governments in order to advance social and health objectives. Next slide, please. And this is kind of morphing now in this kind of more recent phase of the pandemic. Towards presenting themselves as partners in building back better. So if we look at the World Economic Forum, AB InBev presenting them beer as an engine of economic growth, a similar line that they're taking in conversation here with the director at the UN Information Center, part of a long-standing campaign of trying to position beer companies as contributing to the achievement of the Sustainable Development Goals. Next slide, please. And internationally, we can see a particularly strong emphasis in the context of the pandemic and response on empowering women. So if we look at Pernod Ricard Foundation in India, for example, very strong emphasis on empowering women, on targeting female entrepreneurs. We can see similar themes emerging from AB InBev across Colombia, Peru, and Ecuador in this region. Next slide, please. And why does this matter? Well, it matters because I think COVID is a key moment in broader debates about partnership and collaboration in health governance. And again, it looks like a bit of a detour, but if we look at the WHO Foundation, a recently established initiative in order to leverage resources from the commercial sector, we have the really kind of extraordinary example of the WHO Foundation accepting funding from Nestle despite long-standing breaches of the infant formula code. Next slide, please. And this is relevant in the context of alcohol because the WHO Foundation is also very unclear about whether or not alcohol companies are going to be legitimate participants in this initiative. So initially, it looked as if alcohol companies were straightforwardly to be excluded as sources of corporate funding for WHO activities. But earlier on this year, this was quietly switched from a red, straightforward prohibition towards an amber or orange category in which it would be considered on a case-by-case basis, which I think raises some really important questions about how the alcohol industry is seen in collaboration for global health moving forward. Next slide, please. And this is in a context where the pressures on WHO in the context of the Sustainable Development Goals to partner are really very pronounced. And I think this is particularly challenging for colleagues working in the alcohol space in WHO and other international organizations. But it's really important that we question the unthinking dominance of the partnership paradigm in this context. And I think COVID is re-emphasizing some of the challenges of doing so. So Dr. Tedros, a couple of years ago at the World Health Assembly, spoke about partnerships being the only way. Well, partnerships clearly aren't the only way. We know this from tobacco control and from other contexts. And it's really important that we question the appropriateness of partnership and collaboration in alcohol governance. Next slide, please. So what does this mean for policy? Well, you know, if we look at the kind of overall review of the of how alcohol and other unhealthy commodity industries have responded to COVID, it's very clear that industry CSR actions have demonstrably been designed to perform marketing functions, to advance long-standing cross-border strategic interests around brand, around company, industry performing global governance functions, that we need to understand and also to regulate corporate philanthropy as a tool of legitimization for alcohol companies rather than as charitable donations. That CSR and philanthropy have to be central to effective approaches to regulating advertising, promotions, and sponsorship. And that overall corporate responses to COVID really heighten the need to manage conflict of interest proactively in health governance. And final slide, please, Isabel. Okay. So I'd just like to thank you for your attention and to please ask you to consider contributing to this project to continue mapping how the alcohol industry and other unhealthy commodity industries are responding to the pandemic in the region. I think it's going to lead to some really important contributions to debates moving forward. Thanks very much.
Thank you, Jeff. That was an excellent presentation. Now we're going to move to Alafia Samuels. With you, the floor.
Thank you very much. Sharing my screen. Okay, you can see the screen, all right?
Yes.
Okay, good, thank you. Good morning, good afternoon, I guess, for some people, everyone. Thank you for the opportunity of speaking to you this morning. So I thought I would just start with some data, which is hot off the press. This is the Jamaica Health and Lifestyle Survey that was done in 2017. The results are just now coming out. I put this here because I know that the alcohol industry often speaks to our estimates of alcohol consumption being distorted because of the high level of tourism and tourism consumption in the country. And so I do think that to just simply take alcohol consumption and divide it by our population would not reflect the true level of alcohol consumption, because we would be ignoring the fact that a lot of that alcohol was drunk by tourists. So I think that one of the alternatives is population-based surveys. And this one uses sort of the STEPS methodology. So it is population-based. And when we do this, we can get a better idea of the citizens of the country and the burden of alcohol on the citizens of the country. So here we see, of course, the large male-female differential, as we would know, but current drinkers, about 60% of men and about 25% of women. And I think that collaborates some earlier data from a previous speaker that spoke about the high level of drinking prevalence in the region of the Americas and certainly in the Caribbean, and this is Jamaica specific. Among current drinkers, about 14% of men and 4% of women are binge drinkers. And we use this time around the audit score, which is a questionnaire, around alcohol addiction, where a score of 8 or more, so that would be the risk level 2, 3, and 4, is associated with harmful drinking. And we can see again in men, that's about 14% and about 4 or 5% in women. So 1 in 8 male drinkers is drinking, it's harmful. Then I thought I would just share with you the different approaches between the region, meaning member states' priorities for alcohol, and the industry priorities as they are showing it. And I am showing this because I know all of you know that when we are setting policy, industry should not be at the table, because when you look at the industry policies on the right and compare them with the government or the member state policies on the left, you can see, for example, regulating commercial and public availability, whereas the industry thinks we should just enlist support. So the industry always comes with something that's very weak. When it comes to taxes, they have absolutely no proposals on taxes. They think it shouldn't be done. The one area that they are looking at is this product information and labeling, where they are really seizing on that in this region to say, okay, we're putting some labels on some of our alcohol, and so we're wonderful and we're helping you out and all of that stuff. In terms of the Caribbean, alcohol and COVID, in the Caribbean, as was illustrated in other regions, the rum producers modified their product line to include alcohol and hand sanitizer, sometimes branded. These were donated to governments and institutions, including schools, and to frontline health workers and communities. As was said before, they ramped up their corporate social responsibility efforts, including money and well, unhealthy food was a big one too. And then they tailored their marketing campaigns to COVID-19, excuse me, to include adverts aimed at women and young people. If I could get my cursor to get to the right place, thank you. So here are some examples, some across the Caribbean, donations from the alcohol industry. And of course, they want the photograph with the officials to validate their contributions. The marketing we spoke to before, same thing, very quickly, converted their marketing to accommodate the social distancing and all of the pandemic efforts. And then targeting women. Again, this was mentioned, and these are some of the images from across the Caribbean in terms of during COVID, who said staying in should be a problem, and there's a woman, eating and drinking, of course. So keep up the drinking, folks, is the message. And then young people was mentioned, also capture the play, and the play this time, of course, would be the alcohol that you're supposed to remember to drink your alcohol. Don't forget to drink your alcohol, basically is a message here. Have fun and drink more alcohol. This one was a little definitely disturbing. The House of Angostura announces new ambassadors, and it picks out all the young influencers. And, when the young people see that the people who they look up to are supporting alcohol, then it becomes very socially acceptable and the social norm, in fact, to drink alcohol and to drink a lot of it during lockdown. Of course, they were building brand goodwill as well. Regional distilleries joined the fight against COVID-19. We mentioned earlier, some of them were making hand sanitizer. And of course, brand goodwill among school-age children. So you go to the school to donate stuff, but you make sure that your brand is there so that the brand sticks in their mind as being people who help us and people who do good things for us. Mentioned already, but in the Caribbean, a particular example, Carib Bears campaign, Pass the Carib, asked for videos to be uploaded by fans, showing them passing a Carib Bear to friends around the world virtually, which would be a good thing to do during lockdown because we have to keep drinking. They did sponsorship of festivals and other drinking occasions, and of course, lobbying never stops. So in terms of they are actively looking to substitute their policies and are promoting to either develop new or preserve existing self-regulation and voluntary codes of practice. It's all about, you don't regulate me, we'll do it ourselves. They're lobbying for passage of weaker legislation, and they're all into this concept called responsible drinking. But of course, we know that a lot of their alcohol sales come from binge drinking and people who drink too much, and they are not interested in that kind of thing. In fact, they absolutely do not wish to discuss anything to do with alcohol poisoning. In fact, the other day I was on a conference call with Caricom, where we are engaging with the alcohol industry in terms of implementing certain policies. And I put up a screenshot of a definition of, I spoke to alcohol being a poison and alcohol poisoning. And one of the industry people said, oh, we don't think that's a very helpful comment to be making, and we should avoid this kind of commentary and so on. And so I posted the medical definition of alcohol poisoning in the chat and referred them to it and said, we may want to deny it, but alcohol poisons and kills people. So let's not forget that in this discussion. But they don't want to talk about alcohol addiction, this thing about limiting advertising and all that. They're not interested in that. And taxes, very, very bad word for them, because that is what is one of the things that works. Maristella spoke to that earlier. The other thing that they never talk about is the role of alcohol consumption and violence by perpetrators, by victims, alcohol and youth violence, alcohol and child abuse, sexual violence, intimate partner violence, abuse of elderly people. These are things that need to be brought to the front and center when we are talking about alcohol. It is not a benign product, as the alcohol industry is trying to tell us. So the role of civil society in fighting back, which is part of the title of the presentation. One of the things we are doing in the region is supporting the Global Alcohol Policy Alliance. And we spoke earlier about the WHO Global Action Plan, which we are looking forward to. The Healthy Caribbean Coalition, which I think everybody knows is the large umbrella NGO in the Caribbean, is supporting GAPA and the Ministries of Health as well. In terms of fighting back, I really need to say a little bit about capacity in small island developing states. In the 20 members of the Caribbean community, we have English, Spanish, Dutch, and French. And among these 20 countries, there is no civil society organization, NGO, or faith-based organization working primarily or exclusively on alcohol issues, as far as I know. If there's anybody on the call who has such an organization or knows one in the Caribbean, I'd be very happy to hear about it. There was the Caribbean Institute on Addictive Disorders, previously called the Institute on Alcoholism and Drug Problems, does some work on alcohol, but their output and presence has been minimal in the past 5 years. Healthy Caribbean Coalition has had a few positive outputs and has done some work with PAHO, but fighting back, and this is a quote from Dr. Rohan Maharaj, who is their HCC's advisor on alcohol, and we spoke about this presentation, and he was saying fighting back is a big ask. And so I looked at our risk factors for NCDs and looked at the response in small island developing states with limited human capacity. The whole Ministry of Health may have 100 people, and in some countries, 100 people is just a small department in some forgotten area. But that's the whole Ministry of Health for us. So capacity is limited. So in terms of the risk factors, we have tobacco. Yes, we have dedicated organizations. Coalitions for tobacco control exist in several countries across the region. In terms of diet and nutrition, we have organizations made up of professional nutritionists as NGOs who do speak on these matters. Physical activity, there's a lot of commercial activity with gyms, athletic shoes, and so on. In terms of NGOs, usually just sponsoring 5 or 10K events. In alcohol, there is no dedicated one. Arrive Alive, I'll talk about in a second, includes drink driving. Air pollution is the 5th most recently added one, and there's very little action, either by government, NGO, or anybody else on air pollution. So this is an area that definitely has to be built out. So Healthy Caribbean Coalition and also other organizations in countries like, Heart and Stroke Foundations and so on, Violence Prevention Alliances and so on, will address alcohol, but there's no dedicated alcohol. This is the Healthy Caribbean's annual Caribbean Alcohol Reduction Day that was held recently. You can see Dr. Maristella featuring in the middle of that poster. She has been very helpful to the Caribbean. As I mentioned earlier, Arrive Alive is a Trinidad and Tobago NGO for road safety. And they're working especially during this decade of action for road safety, 2011 to 2020. And they do have one aspect of their program which says respect the road, don't drink and drive. But their focus is on overall road safety and look at the driver, the vehicle, and the roads. So they do good work, but it's not totally dedicated. Now, I thought I would just share with you also what is happening in Caricom with regards to alcohol and the Caricom process. As you know, in 2007, the Caricom heads of government had the Port of Spain Declaration on NCDs, and a 2016 evaluation report to heads about country implementation of the Port of Spain Declaration. And as a result of that report, they issued a communique in 2016, which spoke to several things, but asked also that we address matters related to trade and NCDs. And so a joint COSOD, which is Caricom's Minister of Health meetings, and COTED, Council on Trade and Economic Development, which is where Ministers of Trade sit. A joint COSOD-COTED on NCDs and trade was convened in November 2019. This was the first time that trade and health ministers in the region were sitting to talk about NCDs. So that meeting was held on the 4th of November, and the ministers of health and trade listened to reports and so on, and then agreed that in terms of follow-up, there would be 2 intergovernmental working groups, and one would be on unhealthy diets, and the second one would be on harmful use of alcohol. The ministers of trade in particular insisted that we engage the private sector and civil society organizations in the deliberations, and Caricom and CARFA would serve as joint secretariats. Now, as I mentioned before, we recognize that industry should not be at the table when policy is being decided. And so the first meetings of the intergovernmental working groups were only member states, CARFA, Caribbean Public Health Agency, and the University of the West Indies. And we looked at the entire alcohol agenda, and the member states decided that in year 1, they were going to focus on what you see in red: regulate commercial and public availability of alcohol, update and implement legislation on drinking and driving, and education and awareness. And so with those policy decisions made, we convened subcommittees now, which included more NGOs and included the alcohol industry. So here I'm just showing you the schedule of events, so to speak. And I put the alcohol ones in larger type because that's what we're talking about. But it has been a joint approach with unhealthy diets and alcohol going in parallel. So the first meeting of the intergovernmental group, as I said, was just the member states and so on, and that took place in April. The second meeting was actually held on the 3rd of August and included PAHO and some presentations from PAHO. But what we did that day is that we split. You will notice on August 3rd, there are 2 meetings, one in the morning, one in the evening. So the morning one had PAHO, and then the evening one, the afternoon one, we brought in the alcohol industry. Then we had discussions, we outlined our priorities and asked the alcohol industry how they plan to contribute to our priorities. Coming out of that discussion, there's going to be a draft done that will go to the ministers, the joint co-head in November for policy decisions. And so what will happen is that the recommendations from both the member states and the industry will be put together. Where we disagree, that will be made very clear. And then there will be, the document will be circulated and so on. But basically, a document will go to contend, COSOD, which is trade ministers and health ministers in November, that will put forth recommendations about alcohol and also about harmful diets. And the ministers of trade who insisted on the presence of industry will not be able to use the absence of industry from the process as a reason not to proceed, because that was made very clear to us at the meeting in 2019. The alcohol industry, the food industry, that is the constituents of the ministries of trade. And they will not engage with us unless we engage with industry. So we need to, as they say, when you sup with the devil, you use a long spoon. But we need to move the process forward. And therefore, we need to have industry's response, whether it be positive, negative, or whatever, but we need to have their response. And I think this is what Dr. Tedros was talking about when he said that we need to dialogue with industry, because as academics and as bureaucrats, we really cannot change anything. It's going to take the member states' political will, and it's going to take changes that the industry will have to be forced to make, but they have to be at the table at some point in the process. So that's it from me. Just want to thank you for your attention and end up with sure.
Thank you very much. If you can stop sharing the screen. Alafia, could you stop sharing the screen? All right. Okay. Thank you very much. That was really good presentation again. And so, as you can see, we have a view of all countries in the region of the Americas, and already a broad overview of the impact of the alcohol industry during COVID and despite, regardless of COVID. And now we're gonna have a perspective in comparison with countries in the European region, and with Michele Cecchini.
Hello, everyone. Thanks, Maristella, for the floor. It's a real pleasure to be here with you all. Bear with me a second while I put on my slides. And now you should be seeing my screen in presentation mode. Perfect, thanks. So I was introduced at the beginning of this workshop. My name is Michele Cecchini, and I lead the work on public health at the OECD. In the next 15 minutes or so, I will try to compare Americas to the rest of OECD countries and see what are the common lessons that we have learned during the COVID pandemic, but in particular, what are the policies and the impact of the policies that we should put in place to tackle harmful alcohol consumption in the context of COVID-19. As a recap, I don't want to go into numbers, but presenters before me, Jurgen and Maristella, have showed how COVID-19 has impacted alcohol drinking behaviors and their correlated harm. We have heard about modification in patterns of alcohol consumption, in volume of alcohol consumption. There were significant modification on where people purchased and consume alcohol drinking. We have heard that there are some population groups that were most affected by others. And the other thing that we see in European countries, but that's also what I heard this afternoon, is that there were, if anything, an increase in calls about domestic violence, and possibly down the line, a further impact of alcohol consumption modification during COVID-19. And that's really on this latter aspect that we focus my talk. We already know that harmful alcohol consumption has a significant impact on the health and economic burden of countries in OECD region, but also PAO9, I called this region, which includes Canada, Costa Rica, Colombia, United States, Peru, Brazil, Argentina, Mexico, and Chile. These are the 9 countries for which we carried out analysis along with other countries in the OECD region and G20. And on the left-hand side, you see that according to our calculation, by using available evidence and feeding this evidence into the OECD microsimulation model for NCDs, if we look at what our model produces in terms of estimate for the next 30 years, life expectancy will be 1 year lower in this 9 group of countries than it would be otherwise in the absence of harmful patterns of alcohol consumption, patterns and volumes of alcohol consumption. And that's mainly driven by the diseases and the medical condition caused by harmful alcohol drinking. The impact on healthy life expectancy will be even a little bit higher than the numbers that you see here on life expectancy. And both the estimates on life expectancy and healthcare expenditure that you see on the right take into account that in absence of harmful alcohol consumption, people would develop other diseases that may not be amenable to alcohol, but to other risk factors or to the aging of the population. So this is really the net impact of diseases caused by alcohol on people's health. And if we look at the graph on the right, you can also see that the impact in terms of healthcare expenditure will be non-trivial in the order of magnitude of 28.5 USD PPP per capita per year, rather than would be otherwise, ranging from very little from Mexico, but up to almost $150 per year in the United States. And clearly, these numbers are even bigger when we look at people that have drinkers compared to the general population, that also include, for example, children in the denominator, and also people that do not drink alcohol. So in fact, the numbers for drinkers and even larger would be larger and even larger for people that have harmful alcohol. The condition caused by harmful alcohol consumption carry a significant economic burden for countries, but also for individuals, even if these individuals do not drink alcohol. So our analysis point to the fact that these diseases affect workforce employment and productivity, lowering the outputs of the workforce by the equivalent of about 285 USD per capita per year, ranging from $48 in Mexico to more than 1,000 to almost 100 US dollar in the US. This has an effect on the GDP of these countries, and the graph that I'm showing here shows you the impact in terms of percentage point difference in GDP due to diseases caused by harmful alcohol consumption over the next 30 years based on the average per year. So if we take POW 9 countries, a little bit less than 2% could be the GDP that would be higher in absence of diseases caused by harmful alcohol consumption. Countries have a debt. This debt is repaid by what is produced through the GDP and the income of the country, and to maintain the threshold between the debt of the country and the GDP constant, essentially diseases caused by harmful alcohol consumption cause an equivalent of tax increase of around 174 USD PP per capita per year. Essentially, this is a hidden tax that everyone in the country has to pay to bear with the reduction in GDP that is caused by diseases and reduced productivity due to harmful alcohol consumption. And again, there is a large difference across countries. It's as low as 17 US dollar in Argentina to 650 US dollar per capita per year in the United States. Now, the next step in our analysis, once that we identified the large health and economic burden that harmful alcohol consumption has on countries, was to look at the area of improvement for countries. We look at WHO data and evidence in the literature, and we identified some gaps in the policy action. In particular, the 4 key gaps that we would like to highlight is that only a minority of the 52 countries that were included in our analysis have a written national policy and action plan for alcohol consumption. Among these 37% of countries, just a little bit more than 1 in 3 countries, there are only 2 countries in the POW 9 regions that have a national policy and action plan. 74% of countries do not adjust for alcohol taxes for inflation, including at least 5 of the POW countries that do not adjust automatically alcohol taxes for inflation, which is one of the factors contributing to the increase in affordability of alcohol. The majority of countries do not have the most effective regulation of advertising, particularly in the case of social media. And we have heard at the beginning of our workshop how important was advertising and campaign on social media or new media for alcohol products. Then we found data only for Europe and United States, but I suspect that this number is certainly not majorly bigger for other countries that are participating to the discussion this afternoon, this morning for your time, but less than 10% of those potentially benefiting from screening a brief intervention in primary care are actually covered by this intervention. So these are gaps, areas in which many countries can improve, and improving in this area has a significant potential both for keeping healthy the population, decreasing healthcare expenditure in this country, and increasing labor force productivity. And here are the analysis we carried out, the average we carried out for 7 countries in the region. Those mentioned in the note at the bottom of my slide. And for each of these interventions that are the most common intervention that usually countries implement to tackle harmful alcohol consumption, you have a result in terms of disability adjusted life year, gain per year per 100,000 population, impact on healthcare expenditure, additional full-time workers per year, and return on investment for every dollar invested in each of these policies. Policies varies. There are intervention in programs in the workplace or school-based. There is advertising regulation of different types, from an advertising of regulation to decrease the amount of advertisement, but without significantly reducing it, to ban of advertising of alcohol product to children, treatment and counseling in primary care, as well as price policies and regulation, for example, for sobriety checkpoints. And you see that depending on the type of intervention, they may have a bigger or smaller impact, also taking into account the time that this intervention need to produce effects. For each of these interventions on our publication, you can find the results specific for each of the countries. But even more importantly than the single intervention, what I would really like to discuss with you today is what we call the PPPP approach, which addresses many of the policy gaps that our analysis has identified. This comprehensive package includes policy enforcement to limit alcohol-related injuries and violence, protected children from alcohol promotion, primary care to help patients with harmful drinking patterns, and pricing policies to limit the affordability of cheap alcohol. And the results in the 7 countries in the PAO region would be significant. We could save by upscaling these policies almost 1.8 million cases of alcohol-related condition per year. The savings would be order of magnitude across the 7 countries of 16.4 billion, which, to give you an idea, would be in the order of magnitude of the healthcare budget of Chile. So we are talking about a significant amount of money that could be saved, even accounting for the fact that other diseases may increase their prevalence. These countries would benefit for about the equivalent of about 800,000 additional full-time workers per year due to increased productivity and reduced absence from work. And the economic benefit would be in the order of magnitude of $16 gained in GDP for each dollar invested in this package. Now, how does this fit in the context of COVID? We argue that investing in this package during COVID time is even more important to promote resiliency and to restart the economy. Protecting young people from alcohol promotion, particularly through internet and social media, is very important because we know, we have been told how much younger generations have been spending on this new media, particularly during the pandemic. We need to strengthen primary care to help patients, particularly those with harmful patterns of alcohol consumption, which is a common response to cope with high level of stress. And the presentation by Jurgen Ram at the beginning of this workshop showed very clearly how these people have a much higher risk of developing complication of COVID and how harmful alcohol consumption has an impact also on the pandemic beyond the impact on patients themselves. Finally, cutting cheap alcohol, again, should be a top priority because this is disproportionately consumed by individuals with harmful patterns of alcohol consumption. Not to account that policies such as the minimum price can have a positive effect on income of bars and restaurants that are among the sectors that were most hit, particularly in the early phases of the pandemic due to lockdown and the closure of services. I stop here. You can reach out on my email for any question, and you can find all the graphs also for country-specific analysis on our website. Thank you very much for your attention.
Thank you very much. You can stop sharing your screen. Yes, thank you. This clearly shows that our region has a lot to be done ahead of us, and the tools are available. The WHO is starting to discuss the draft Global Alcohol Action Plan, and we are at the end of our regional plan, and we don't know yet what is going to be the next steps, but it depends on the member states. But we have a tremendous opportunity now with the WHO Safer initiative and other actions that will be launching towards the end of the year to get going and improve the health in the Americas. I'm going to open the floor for questions and comments. I have here already some that was placed before from Mexico that says Mexico in the beginning of the pandemic, there was a limitation on the production and sales of non-essential goods, but alcohol wasn't it. But at the same time, people began to buy informal alcohol or produce home-produced alcohol. And that was linked to an increasing number of severe alcohol intoxications and some deaths from adulterated alcohol. And he is asking Arturo Sabines if there are other cases like that in another region, another country of the region. Jurgen?
There have been similar cases in a lot of countries. However, when you, and this is cruel, but by far the deaths saved from less alcohol outweigh the deaths through methanol. The other countries where these things happened are not only in the Americas, they're also in the Iran, which has the highest number of methanol deaths during COVID. They are in Turkey, which has probably the second highest, if we know, or India. And we know overall that by all our accounts, unfortunately, the methanol poisonings with severe consequences such as blindness or death increased. But in all of those countries, according to the calculations, the deaths which were avoided by other kinds of causes of death, such as liver cirrhosis and other deaths, decreased way more. The problem with any kind of ban, from starting with the prohibition in the Americas in the 1920s, is that illegal alcohol has been increasing, but all of the calculations have shown that the increase in illicit consumption by far is outweighed by the decrease in illicit consumption. However, there is a lesson for governments. Whenever you implement partial bans, please go and consult the literature on what you should be doing to prevent unrecorded alcohol consumption. As Michele has shown in his presentation, the most successful alcohol policies are joint policies, where different elements come together. And part of what we have seen in COVID is that sometimes bans have been implemented without the necessary countermeasures for unrecorded or illegal consumption.
Thank you. I should add that cases like that also happen with some frequency in the Dominican Republic. And to a point that the government actually began to enforce the law that they have against illicit alcohol and go after these producers. They knew where they were and shut down some factories and some local producers, but the rest of the policies continue unchanged. And in addition, they began to promote that people could go to get vaccinated in bars. So that is difficult to analyze, to say the least. And I've seen comments also about domestic violence that has increased in Peru. And I don't know from who it is, Andre, that another comment that violence has increased, domestic violence. And there is a comment here, the online advertisement of alcohol and the participation of alcohol industries in philanthropic activities are very important issues. What would be your recommendations to address them? From Mexico. And Jeff, I think you can answer that.
Sorry, Maristel, I was frozen there. Would you mind repeating the question?
Yes, the online advertisement of alcohol and the participation of alcohol industries in philanthropic activities are very important issues. And what would be your recommendations to address them?
So I think in terms of the agenda moving forward, firstly, it's really important to recognize that the distinctions between corporate social responsibility, philanthropy, and marketing don't exist in the corporate world, and I don't think they should exist in terms of how we think about them from a regulatory perspective. So if, for example, we are thinking about developing approaches to regulating cross-border marketing, I think it's very important that any actions taken in that place also consider corporate social responsibility and philanthropy as part of the marketing mix. That's very much how corporations approach these perspectives, and these activities are intended to serve strategic and marketing functions. So I think it's important that we don't somehow kind of treat them as separate to marketing as conventionally understood.
Sorry, thank you. I have here a question if I suppose we or one of you two, we, Pajo, if we have done work together with any country, any government in the region to analyze the situation during the pandemic in terms of public policies and prevention. And we have not worked directly with any government during the pandemic. We promoted the regional survey as a way to facilitate the access to data that each country could use to develop such policies. And we did a lot of health information, meaning through webinars and campaigns via social media. And what we are doing now, began this year, was to work with some countries on implementing the SAFER initiative of WHO. That includes Mexico, Bolivia, Argentina. So it's in progress, that work. And the other question is if there was any government that implemented a campaign on alcohol and COVID. I do not know about that. I know in the region, we promoted and had fact sheets and a lot of information available in our website. And we did dozens of webinars, and countries used the material that we prepared and made available in several languages. But I don't know if there were specific campaigns related to alcohol and COVID. And my opinion is, my guess is possibly because the pandemic itself needed so much attention in terms of measures to control the epidemic, health services, and also, and then the vaccines, then they continue, and that took their largest priority in the agenda of governments. And second was in mental health, in which we included alcohol as being used to cope with mental health issues, but I am not aware of any specific campaign on alcohol and COVID. I don't know if they were done in Europe or Canada, US. I guess not. Jurgen?
Just a different country. The largest campaign on alcohol and COVID was done in Japan, based on what the government explored about the spreading of COVID. They identified drinking alcohol in bars and in restaurants as one of the major reasons. And so when they reopened restaurants, so they kept closed bars, even for lower levels of confinement. And when they reopened restaurants, until now, alcohol is still forbidden. And in order to understand this measure, they had an information campaign showing some of the numbers, how alcohol has actually contributed to COVID. And that's the closest I know about a government trying to link alcohol and COVID in a campaign.
Thank you. And you and Michele and others have been are being invited. If you could be invited to present at country level, I think it's Mexico, on what you just spoke.
I mean, I'm welcome. Sure, I would do that. But I think if there is nobody from Mexico who does it, I'd be happy to give those information, especially comparing to other countries, or for Peru, it doesn't matter. But we should always, I try to avoid country alone presentations because they're often quite good local researchers.
Yes. And let's see if there was another comment. And I think also what is important is now that we see so many new activities happening very fast in terms of losing the alcohol policies at local level, allowing for public drinking or on the streets or take home alcohol. And we heard from Brazil that they are giving, when you do your grocery online, they deliver free samples of new type of alcoholic beverages, which is unheard of ever before, and never ask about age or anything, or there are children in the house. They just send you free samples. And we also hear where alcohol is being allowed to sell even more. For example, at airports, we heard about a complaint from the Federal Aviation in the US, because people can buy the alcohol in the airports to take on board. And there have been an increase in the violent incidents against the flight attendants because of drunk people. Some airlines prohibited alcohol during COVID, but others continue to serve as before. But adding to that availability is increasing the harms and putting people in danger, I suppose. Okay, so we are coming close to the end. I'd like to pass the floor to Dr. Renato Oliveira again for some closing remarks. Thank you.
Thanks again, Maristela, and thanks for all of you who attended the webinar today. The presentations made and the information shared provide a clear message to all of us. Given the stronger interrelationship between alcohol and COVID, alcohol policies should be maintained or strengthened during the pandemic, not relaxed. Therefore, alcohol controls during any pandemic are an essential part of the public health response. We have learned from what happened in different jurisdictions in the Americas and from around the world. And the outlook as we recover from the pandemic is problematic, as the increased access and provision of alcohol is having negative consequences now and into the future. But it's preventable. We can safely support several measures recommended by global experts already, as published in the report, Alcohol and the Coronavirus Pandemic, Individual, Societal, and Policy Perspectives. They need to be considered in the preparation for future pandemics, and so we can mitigate the problems that we are facing. So it's fundamental that to suspend alcohol services at sports arenas and large events, prohibit alcohol consumption in public places, restrict drinking at high-risk settings such as bars, nightclubs, and airports for travelers, impose limits on home delivery if permitted at all, make clinical and treatment provisions for people who experience all types of alcohol-related problems, including dependence, increase access to mental health services, including online services. And health authorities should advise individuals at high risk for infections or serious complications to reduce or avoid alcohol use. The most effective policies, including those to reduce physical availability of alcohol and increase its price through increased alcohol taxes and minimum prices, could help limit viral spread, reduce the burden on health services, and raise much needed extra government revenue that can be used to build more resilient health systems in the Americas. So again, thank you all for joining us, and I wish you a good continuation of your day. Thank you.
Thank you very much. I also want to thank all the speakers, and the recordings will be available through our website and be sent to all who registered, as well as the presentations. So thank you very much, and till next time. Bye-bye.